begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in this episode, I'd like to discuss thyroid issues, both hypothyroidism as well as hyperthyroidism. Now I've inserted this topic ahead of others because I've had an interesting chat session 2 evenings ago with several individuals regarding their present thyroid situation and the fact that both hyper as well as hypothyroidism being considered an autoimmune disease. Now, and for the record, if you were to ever become interested in engaging in a chat session regarding acupuncture, simply go to the Google Play Store and download the Acupuncture is My Life app to discuss whatever comes to mind regarding acupuncture and your health. Now back to the topic of discussion. For those who are unaware of what hyperthyroidism is, it's basically the overproduction of thyroxine, which increases metabolism, whereas hypothyroidism is a condition in which the thyroid gland does not produce enough thyroid hormone, resulting in a slowing down of the body's metabolism. I've informed the individuals with which I chatted with that although both hyper and hypothyroidism can be seen as an autoimmune disorder, it is not an immune compromised state that would enhance complications as a result of becoming infected by COVID-19. Now, some patients diagnosed with Graves' disease are prescribed a drug called methimazole, which can have a rare side effect of decreasing the white blood cell count, which makes them more susceptible to infection. But this risk is extremely rare. As I've stated in my thyroid issue chat sessions, these are great questions to ask your physician. Again, I am not a medical doctor. I'm a state licensed, board certified doctor of acupuncture. Now, if you were to feel as if, let's say, you're experiencing any complications of your pre-existing condition as a result of becoming infected with this virus, please consult your physician immediately. Following consultation, if you feel you may be interested in pursuing acupuncture to help you manage your present condition, contact your local acupuncturist to discuss your case. So if you're concerned you may be at a higher risk of contracting coronavirus because of your thyroid condition, from what I'm seeing, there's currently no reason to believe that individuals with thyroid conditions, whether autoimmune or not, are at an increased risk of contracting COVID-19. Now, if there were to be a high-risk group, that group would consist of those who were diagnosed with thyroid eye disease and are receiving steroids or immunosuppression therapy. Some in my chat have asked if I'd seen anyone with thyroid conditions during this pandemic who were concerned, and can acupuncture help someone manage their thyroid issues? And the answer to both of those is yes. Now, from a Chinese medicine perspective, the root of hypothyroidism as a pathogen is yang qi deficiency, in which subsequent symptoms are derived from, which is yang qi's failure to warm, motivate, and transform when it comes to hypothyroidism. The main organs that tend to be involved from a Chinese medicine perspective are the spleen and heart. Contributing factors can include improper diet, overall constitution, and overexertion, among a few others. Now, hypothyroidism may be a result of spleen and kidney yang deficiency, whereas a patient may present with tiredness, feeling cold, edema with a pale complexion, puffy face with puffiness under the eyes, shortness of breath, and dizziness with poor digestion. Now, the tongue would appear as pale and swollen. Now, in such a case, I would look to warm yang and strengthen the spleen and kidneys by needling points on the bladder and stomach channels, as well as the conception vessel, to tonify spleen yang and affect the thyroid gland directly. I would also needle points on the governing vessel to strengthen both, let's say, the kidney and heart yang. I would needle points on the kidney channel to tonify kidney yang, as well as needling points on the stomach and spleen channels to resolve phlegm. I would also needle points on a directing vessel to sort of like tonify kidney yang as well. Now, another potential pattern could be as a result of qi and blood deficiency, whereas the patient may present with tiredness, weakness with a dislike for talking, palpitations, loose stools, dry skin, and cold limbs. The tongue would appear as pale. Now, in this case, I would look to tonify qi and nourish the blood by needling points on the bladder, stomach, and spleen channels to tonify spleen qi and nourish blood. I would also needle points on a conception vessel to tonify the kidneys and nourish blood and affect the thyroid. I would also needle points on a governing vessel to lift the qi. Another potential pattern could be, let's say for hypothyroidism, is liver and kidney yin deficiency, whereas a patient may present with tiredness and feel hot in the afternoon and evening with night sweats. They would also have backache, dizziness, hand tremors, and blurred vision. The tongue would appear as red without a coating. Now, in this case, I would look to nourish yin and strengthen the liver and kidneys by needling points on the stomach, spleen, and liver channels, as well as needling points on the conception vessel to nourish liver yin. Now, I would also needle points on the conception vessel as well as the kidney channel to nourish kidney yin. Now, I would look to open up the directing vessel to nourish yin, as well as needling points on a conception vessel to act on the thyroid. Now, those are some of the potential basic patterns of hypothyroidism in traditional Chinese medicine. Now, when it comes to hyperthyroidism, some of the more common patterns can be either liver qi stagnation, whereas a patient may present with the beginning stages of hypothyroidism, nervousness, restlessness, intolerance for heat, palpitations, fatigue, irritability with mental restlessness, depression, moodiness with abdominal distension. The tongue would appear with, like, let's say, slightly red sides. Now, in this case, I would look to calm and move liver qi and calm the mind by needling points on the sanjiao, gallbladder, liver, and pericardium channels to move liver qi and calm the mind. I would needle points on the large intestine and liver channels, as well as the conception vessel to calm the mind and affect thyroid function. Another potential pattern of hypothyroidism could be heat in the liver, heart, and stomach, where the patient may present with hypothyroidism, excessive hunger and thirst, irritability, weight loss, nervousness, restlessness, fatigue, constant feeling of hot or heat, and insomnia with palpitations. Now, in this case, the tongue would appear as red with redder sides and a yellow coating. In this case, I would look to move liver qi as well as drain liver and heart fire and stomach heat, and calm the mind by needling points on the liver channel to drain fire and move liver qi. I would needle points on the heart channel to drain heart fire and calm the mind. I would also needle points on the stomach and large intestine channels to clear stomach heat, as well as needling points on the gallbladder and spleen channels. I would also needle points on the governing vessel and the conception vessel to clear heat and calm the mind, as well as affecting thyroid function. Now, another potential pattern of hypothyroidism could be liver and kidney yin deficiency with empty heat, whereas the patient may present with hypothyroidism, mental restlessness, feeling hot in the evenings with night sweating and weight loss. There would also be fatigue, insomnia, nervousness, skin flush, palpitations, hair loss, backache, dizziness, blurred vision with dry eyes. The tongue would appear as red with no coating. Now, in this case, I would look to nourish both liver and kidney yin, clear empty heat, and calm the mind by needling points on the liver, spleen, and kidney channels, as well as conception vessel to nourish both liver and kidney yin. I would needle points to open up the directing vessel to nourish yin. I would needle points on the heart channel and the conception vessel to nourish and calm the mind, as well as affect the thyroid function. I would also needle points on the large intestine, the liver channels to alleviate hand tremors by extinguishing internal wind. Another potential pattern of hypothyroidism could be phlegm, heat in the liver, whereas the patient may present with mental restlessness. Also a feeling of heat with weight loss, fatigue, insomnia, nervousness, skin flushing with itchy sensations all over the body, palpitations, blurred vision, a sticky taste in the mouth with a feeling of chest depression. Now the tongue would appear as like red with a sticky yellow coating. Now in this case, I would look to drain liver fire, resolve phlegm, and dissipate any hardness, as well as calm the mind by needling points on the liver and large intestine channels to drain liver fire, soothe the liver, calm the mind, and clear heat. Now, I would also needle points on the stomach and spleen channels, as well as the conception vessel, to resolve phlegm and affect the thyroid function. I would needle points, let's say, on a governing vessel and gallbladder channel to calm the mind. But these are some of the patterns in which I treated for those who have come to see me during this pandemic with thyroid issues. Now, if any of this sounds confusing to you, simply view some of my earlier episodes on the basic functions of various organ channels in Chinese medicine, or you could just simply go to my website at acupunctureismylife.com and click on Understanding Acupuncture to learn more about acupuncture. Now, don't forget to subscribe to this show, as well as download the Acupuncture is My Life app from your Google Play Store to engage in private or group chat sessions regarding acupuncture and how it can be of benefit to you. And until next time, acupuncture is my life. What's yours?